My name's Barbara Shute, and I'm a family physician, and I also practice acupuncture. Acupuncture is an ancient healing technique where small needles are used to help with healing and to balance and maintain health. I went to University of Maryland and majored in zoology for college. That was 4 years. I went to University of Maryland Medical School, which was also 4 years. I did a residency in internal medicine, which was a 3-year program. The traditional Chinese medicine explanation is that there are certain defined pathways of energy or qi that flow through your body. If there's a problem or pain issues or disease state, it may be that the flow of qi is blocked. So the needles go in specific points along those channels to relieve the blockage and allow your body's energy to flow. There are also conditions where there's too much energy flowing, so you can manipulate the needles to allow that excess to dissipate and to create balance again. It was frustrating seeing patients not getting relief from traditional Western medicine, from medications and facing surgery. So I wanted to explore other options to offer my patients. And acupuncture has always been fascinating for me, so I decided to learn more about it. UCLA in California has a program specifically for physicians, so I did training through that program and have been practicing since 2001. I also received board certification in medical acupuncture a couple of years ago. There's different sizes of needles and different depths depending on how much soft tissue there is and how deep an effect you want to have with the needle. Some of the needles go down to the periosteum or the covering over the bone, and some are just very superficial. There's different techniques, different sizes of needles. The traditional Chinese medicine needles are longer and thicker. They're more aggressive with the treatments. So it depends on where you're focusing and what technique you're using. Initially, I see patients and do a treatment. If it seems to help at all, I repeat the treatment in a week or two. And each time the effects, the benefit should lengthen out to a longer and longer period. So people with chronic back pain or chronic conditions, I usually see once a month or every 6 weeks or so, and tune things up at that point. It's just real individual how long the effects last. Acupuncture's gotten a lot more accepted. When I first started practicing about 10 years ago, there was a lot of reluctance. People didn't even want to consider that as an option for treatment. There's still a lot of fear involved with it. They think the needles are painful and large, and it's really very minimal discomfort associated with the treatments. Once acupuncture has been more accepted and has been on Oprah and Dr. Oz, people are much more willing to consider that as an option for treatment. We can treat a whole array of things with acupuncture. Probably the most success that I've seen personally is with back pain and shoulder pain. A lot of people that carry tension through their neck and shoulders and in low back, it can really help to relax some of the chronic tension. Headaches, it works well with headaches, especially when there's a lot of tension in the neck. Treats sinus symptoms. There are patterns through the face which can help open up the sinuses. Okay. This is Sierra Derrick.
Hello.
And what's going on with you today?
I have a significant amount of sinus drainage and congestion in my face.
Where's most of the congestion? What part of your face?
Mostly back here underneath my sinus cavity and up in my forehead a little bit.
First point I'm going to use is right up in your hairline here. So just take a deep breath for me and then blow out. Okay, how's that?
Good.
Is that painful?
No.
Good. All right, now the ones on the face may be a little bit more sensitive. Are you ready? I'm going to put one here between your eyebrows.
Should I close my eyes?
Yeah, you will want to do that. Take a deep breath for me and blow out. Good. How's that?
Good.
Another one on this side. And out. Good.
Wow. It's not uncomfortable at all either. It actually, you can barely even feel it.
How much did they hurt going in? Which ones were the most painful?
Probably the one in my left eyebrow and then the one right here, but that's it. It really wasn't uncomfortable at all going in.
When we take the needles out, they go into a sharps container, and that gets taken out with our biohazardous waste material, and they're in heavy plastic containers, so nobody gets stuck with a dirty needle. The other modalities that we can use, one is called moxa, which is mugwort. It's compressed into a stick. It looks like a cigar, or the more traditional Chinese practitioners use loose moxa and put it on the needles, but this is a way of warming up the needles, and it has some medicinal value too. So heating up the needles draws the heat into the muscles fairly deeply, and it usually is very soothing and very pleasant feeling, especially with a lot of chronic tension in the muscles. I often use tiger balm after the treatment just to keep some of the heat into the muscle, especially after using the moxa, and that's usually very soothing too. There's some other techniques. Sometimes I'll use cupping, which is a technique where you take small, they look like baby food jars that are plastic, and you can either put a flame into the jars and create a vacuum and then put it on the skin. It creates a welt and draws the skin up into the tissue, which increases blood flow and can help with healing and moving some tension in the muscles. There's another plastic set of cups that I use, which just has like a suction grip on it, which creates the suction. Acupuncture has changed the way that I practice in that I'm more open to alternative therapies. I'm not so closed-minded. I think Western medicine has a certain arrogance that if you can't put a meter in something and measure a number, then it can't possibly work. I really love doing acupuncture. If I had the opportunity, I would quit my day job, so to speak, and just do acupuncture. Yeah, I like the relationship I have with the patients. It's a much warmer, more relaxed relationship where I'm not rushed to see a sore throat in and out and they're gone, but I get to spend time with people and get to understand more about their lives and things that may have an impact on their health. The other thing I love about doing acupuncture is that when it works, it's amazing how well it works. Some people it doesn't do anything at all, but frequently we'll have benefit for people who've tried everything else with surgeries, multiple surgeries and multiple medications and side effects from the medications, and the acupuncture works and people are able to get off medications and able to postpone surgeries and have a real increased quality of life.